Day 9 of learning exercise therapy. Proper position of the affected area is essential for patient with burns. Proper positioning should be maintained consistently throughout the day. A patient with a transfemoral amputation begins gait training with prosthesis. What effect will a hip flexion contracture have on the patient's gait? Answer: the patient's step length on the prosthetic side will be increased. A physical therapist examines a patient with a suspected acutely torn medial meniscus. Which symptom is not commonly associated with a medial meniscus tear? Answer: hamstring atrophy. A physical therapist treats a 32-year-old female diagnosed with thoracic outlet syndrome. While exercising, the patient begins to complain of feeling lightheaded and dizzy. The therapist immediately pushes the patient to a nearby chair and begins to monitor her vital signs. The therapist measures the patient's respiration rate as 10 breaths per minute, pulse rate of 45 beats per minute, and blood pressure of 115 by 85 mmHg. Which of the following statement is most accurate? Answer: pulse rate and respiration rate are below the normal levels. In designing a wheelchair for a patient with bilateral transfemoral amputation, the axle should be moved in what direction? Answer: 2 inches backward. Which aquatic exercise will be the most effective in reducing tone in a patient with spinal cord injury? Answer: slow passive movements of the neck and upper extremities with the patient floating in supine. A therapist prepares to treat a patient in isolation by donning a mask. Which of the following solution categories will require only the use of a mask? Answer: respiratory isolation. A 14-year-old girl presents with a 25-degree left thoracic scoliotic curvature. All of the following are appropriate immediate forms of treatment except surgical intervention. A therapist examines a patient referred to physical therapy diagnosed with bicipital tendinitis. Which of the following special tests will be the most useful to confirm the patient's diagnosis? Answer: Yergason's test.